anything you put in the mouth is shifting your microbiome, whether it's a filling, a veneer, a crown, a grill, whatever you're doing. Think about the long-term impacts of that, because it's never going to be as good as your natural tooth structure.
Welcome to the Dutch Podcast, where we dive deep into the science of hormones, wellness, and personalized healthcare. I'm Dr. Jacqueline Smeaton, Chief Medical Officer at Dutch. Join us every Tuesday as we bring you expert insights, cutting-edge research, and practical tips to help you take control of your health from the inside out. Whether you're a healthcare professional or simply looking to optimize your own well-being, we've got you covered. The contents of this podcast are for educational and informational purposes only. This information is not to be interpreted or mistaken for medical advice. Consult your healthcare provider for medical advice, diagnosis, and treatment. Hi there. Welcome to this episode of the Dutch Podcast. I'm so glad that you're here with me today and listening into the topic this week, which you might think, dental health, why is that something that we're talking about on the Dutch Podcast? But if you follow the literature, what we're really seeing is that hormone health and oral health are really tightly related bidirectionally, and that oral health and the oral microbiome are playing a critical role in our overall health as a population. Today's guest is a functional dentist, and she's really breaking grounds and helping us understand this. She's going to practice in Portland, Oregon, working with pediatric population, but consults on adult health all the time as well. You're going to walk away with so many new connections today, and not just that, some really topical tips to help you really make the change to improve your oral health and really avoid the things that are detrimental to it. You know, Dr. Staci is really passionate because she really sees that oral health and correcting oral health is not just a window to the inside world, but a path towards actually improving our health overall. My guest today is Dr. Staci Whitman. Like I said, she's a pediatric dentist in Portland, Oregon, and she's the founder of No Po Kids Dentistry, where she practices with a holistic focus. She earned her dental degree from Tufts University, we love Boston, and completed her pediatric dentistry certificate at OHSU, and then she became a diplomat of the American Board of Pediatric Dentistry in 2012. Her clinical and research interests focus on children's airway health and sleep, which we'll talk about as well, children and adults, and efforts to improve pediatric airway diagnostics. Now, going beyond dentistry, she's active in integrative health circles. I'm sure you guys have seen her online. She's prolific. She also holds certification as a health and wellness coach and engages with organizations in holistic dentistry and functional medicine. Really excited and honored to have our guest today, Dr. Staci Whitman.
Hi, Jacqueline. Thanks for having me.
So I'm so excited to have this conversation, and I want to just start because a lot of listeners are probably like, dentistry, like why would you have dentistry on a hormone podcast? And, you know, as we think about like rolling into October and breast cancer awareness and like looking at the way we look at complex diseases, including hormone dysfunction, we're starting to kind of piece together that there's a lot of confounding elements. And oral health is something that I've become more interested in because I would do fertility care. And I'd love, we can talk more about that, like preconception and fertility care and what things like periodontitis or other, you know, oral health indicators say about fertility. But the truth is there's like really interesting research on the connection between oral health and systemic health. So I want to start there to just, maybe you can help orient our listeners to like why you care so much about this topic and why they should care in relationship to their hormone health and their overall health.
Absolutely. Well, thank you for giving me an opportunity to elevate this education. You know, I began my journey as a very traditional dentist, as many of us do in our practices, and I just found a lot of dissatisfaction in my career because I felt like I was just constantly putting out fires and dealing with end-stage disease, but I wasn't really addressing the root cause of the issues or putting all the connectors together. And, you know, we've unfortunately compartmentalized the human body so much with all these specialties and subspecialties. And this is where I started to become very passionate about the oral microbiome. And so we learned a little bit in dental school about certain microbes, specifically strep mutans, which is linked in causal of cavities, and P. gingivalis, which is involved in gum disease. But that's about it. It's not really digging deep into what these bacteria and these pathogens can do to downstream issues in the body, such as fertility and hormone imbalances, et cetera, which we'll get into. But this is why I'm passionate about it, because I believe we're missing the elephant in the room, if you will, and it all comes back to the microbiome. And we've studied so much about the gut microbiome and its impacts on systems in the body, including hormone balance and oral health. But now we need to, in my opinion, focus on the oral microbiome. And I also think our physician colleagues need to be aware of this too, because you could be working a patient up and trying to get them on a road of recovery. But if you're ignoring the mouth and you're ignoring what's happening there, and your patient potentially has oral dysbiosis or leaky gums, like leaky gut, they have gingival inflammation, periodontal disease, etc., you could be missing a big opportunity to get your patients healthy again. And so a lot of this does tie back to the state of the microbes and the microbial balance in the mouth.
Yeah, I mean, I'll never forget the first time I heard about a connection. It was probably like the early 2000s, so nearly 20 years ago. It was a patient of mine who was a dental hygienist, and she was someone trying to convert her dentist to be kind of looking at this a little bit more holistically. And at the time, it seemed like the major model for study was cardiovascular disease. Was that the first kind of connection that was made?
Yes, definitely. The bacteremia that can be associated, especially not only of impacting cardiovascular health, but post-surgery too. And so many dentists are taught about this, our antibiotic
For
protocols that are
rheumatic,
needed.
yeah,
Exactly.
for rheumatic fever.
Yeah, and then also after joint replacements or knee replacements, and that's essentially all that you are exposed to really in dental school is the antibiotic protocol necessary to protect these patients before they have dental treatment done. But I will give a nod to the hygienists. Because I do think the hygienists get it. They're in there, they're seeing the tissues, and they're starting to put these connectors together about why is this patient healthy and this one isn't, even though they maybe have the same diet, lifestyle, and habits. What is different? And this is where we need to dig deeper into the bacterial connections and also what's happening with the gut. So we can talk about the oral gut access as well, but I think we're in the moment of a big shift in dentistry, which I'm excited about. And I think, dental disease, cavities, gum disease, periodontal disease are the top chronic diseases globally in the world in children and adults. Many people, I don't think, realize that, or we've just normalized it so much. But common isn't normal, as we know. And humans are not supposed to be having so much oral dysbiosis and dysfunction.
Yeah, I want to start with that, with the kind of this transition that's happening in dentistry, because obviously it's been a long time that this data has been out there. Of course, I'm sure the body of data has grown substantially, but what are the big impediments to the adoption of this philosophy and kind of integration into the regular dentistry education and practice? Because it seems as though, from a business point of view, it provides this huge opportunity where dentistry becomes a critical part of success for almost all other chronic diseases. Mm-hmm. And given the way that associations tend to think about that, I'm just surprised that the adoption's been so slow. And of course, the patients are the ones suffering from that.
Absolutely. I know. It's so funny. I was just speaking about this morning with a colleague. It's always hard to say. I can give you my perspective and what I think is happening. So, first of all, this won't be implemented until the American Dental Association announces it as part of our standard of care, okay, and puts it into our guidelines, essentially, that we should be, let's say, oral microbiome testing every patient, which I believe we should be. But on top of that, and I can speak as a clinician, so dentistry, just like with our colleague physicians, we tend to be a turn and burn practice. We are overwhelmed with the amount of disease coming our way. We have very limited time to work with patients, specifically the dentists. I think hygienists have a little more time, which is perhaps why they're more in tune to what's actually going on. So it's very hard to think about how to shift and spend more time to work a patient up and to add additional things to your already busy workday. Also, insurance isn't reimbursing for oral microbiome testing yet. So this is an insurance issue too. But I think dentists want to be doing this, but we have to remember dentists are clinicians, but many of them are their business owners too. Okay, so they're running their practices, they're managing the team, the HR, the 401ks, keeping the lights on, paying the rent, literally writing the checks to pay the lease. And so it's very overwhelming. How do I implement something new that I wasn't taught in dental school, that my colleagues down the street maybe aren't doing yet? You have to be a little rogue in a way
Yeah.
and think outside of the box. And it's challenging and there's risk associated with it. How do I restructure my schedule? Are patients going to pay out of pocket for this? What do I do with this information once I have it? And this is the challenge too. There is nowhere right now for dentists to go get this training. It's very piecemeal, as I had to find out myself over the past 15
Mm.
years if I've been trying to integrate functional medicine principles into my practice and the way I look at patients, practice clinical dentistry, and also educate. So this is exciting because I've co-founded the Institute for Functional Dentistry, which is launching very soon,
Mm.
and it is going to be a place where we can implement this education and teach dentists how to integrate it into their practices. And then our next step is to help integrate it into dental schools and programs. And then the next step is to target the insurance companies. But this will take some time. So I
I,
don't know the reason. I just think it's
yeah.
overwhelming.
I think it makes sense. It's a whole paradigm shift. And actually, as you go through these, I'm thinking like a lot of our listeners are functional MDs and they're clinicians, and they're probably nodding their heads along
Yes.
with it because they've been the people to ground break. And you're right. It's not just new clinical practice; it's a new business model. It's new compensation. It's a big behemoth beast. So
And you have to educate the patients on it too,
yeah.
right? So,
Mhm.
which is why I'm so thankful for opportunities like this, because this is how we start the movement to change our medical care. It is going to come from our patients to some degree. They are the consumer essentially. And so they
Mm.
need to start advocating for these more updated, very science and data driven protocols. But I encourage my physician colleagues listening, you can oral microbiome test in your office. There are very easy ways. I mean, you're just collecting saliva. And so, I shouldn't be taking this away from dentists, but if the dentists don't step up, I really believe our physician colleagues are going to.
Mm. So let's talk a little bit about oral microbiome because we talk a ton about gut microbiome. The data around gut microbiome is growing. Everybody knows about the gut microbiome now.
Yeah.
It's, common language where that's really changed from 5 or 10 years ago. Now the mouth is the gateway to the gut. It's gut tissue really in a lot of
Yep.
ways. But tell me a little bit about why the oral microbiome, besides availability to test maybe, why is it so critical to be looking at that? And how is it kind of different in the role it plays compared to a gut microbiome?
Yeah. Great question. So the oral microbiome is the second most diverse microbiome in the body, which is why I'm happy it's getting more attention. It directly influences every system in the body. I want people to start thinking of the mouth is the gut, to your point. It's the entryway, it's the beginning of digestion and of our GI tract, essentially. So we need to think of it as such. And so if you're a physician out there treating the gut and cleaning up a patient's, intestinal permeability, let's say, but you're not looking to their oral health, I think you'll be challenged in getting that patient truly well. And think of it this way. So if you have oral dysbiosis, let's say you have gum disease, bleeding gums, inflammation, periodontal disease, cavities, those are signs of systemic inflammation, chronic disease, oral dysbiosis, nutritional and micronutrient deficiencies, okay? Those don't just stay in the mouth. We know this. Everything's connected. And so you're going to have downstream effects. But also, we swallow 2,000 times a day. So we are seeding our gut with the bacteria from our mouth innumerable times a day. And so what are the impacts of this? Well, we know the oral microbiome does influence the gut microbiome. And we are definitely at the beginning of a lot of this conversation, which is exciting. So we need a lot more research and studies to see how everything interacts. But what happens in the mouth impacts the gut and vice versa. And I think with our patients, we have to be cleaning up the gut. I think I would like dentists to know more about gut health, and I would like physicians to know more about oral health if these are your targets. But we do know, the oral bacteria, not only if you have gum disease, inflammation, that will create systemic inflammation, okay, and an immune response, but If your gums bleed, let's call those leaky gums. All right. So if you have bleeding gums, you now have an entry point, of a way, a vector for the oral bacteria to enter the circulatory system, the lymphatic system. And they catch a free ride and they end up in places they shouldn't, like our heart, like our joints, like our uterus, like our colon and our pancreas. But they're also releasing endotoxins, exotoxins, lipopolysaccharides. There's an immune response, so a cytokine response to many of these things. And we're finding oral bacteria. Mostly it's mostly it's correlation right now, but there are some causal research studies coming out, but linked to cancer, specifically pancreatic cancer and colon cancer, Alzheimer's and dementia and cardiovascular issues. Nitric oxide is impacted by the oral bacteria, as well as our sinus bacteria and sinuses. And fertility issues, which we can get to, and pregnancy outcome challenges. I mean, miscarriages can be linked to periodontal disease, P. gingivalis, autoimmune disease, mood disorders, gut dysbiosis. So it goes on and on. It's truly every system in the body can be tied back to the oral microbiome. And these microbes are profoundly powerful. I mean, we know this. So we can't just focus on the gut microbiome. We're learning now there's the skin microbiome and the vaginal microbiome. And so how do all of these communicate to one another and influence one another is exciting, but it's profoundly important as a clinician.
Yeah, I really believe that just like we have like vitamins and herbs, we will develop this skill set and knowledge and awareness to really have more targeted microbiome treatments. Like right now, most brands have like a probiotic.
Right.
With a couple brands like, Pendulum, Metagenic, some that have more targeted. But I think overall that's going to become a category, maybe even a pharmaceutical category where you have very targeted approaches for different microbiomes and different reasons, which is really exciting because we're moving from this like sterility complex into a true understanding of the positive role that these like critical, not just positive, critical role that microbes play in our health. It's really fascinating.
I absolutely agree with you. And we are seeing it. I love Pendulum. I mean, Resbiotic is another brand I know that's targeting the lung microbiome and the gut-lung axis. So I think in 10 years we'll look back at this time and say, oh, how cute,
We were babies.
we were trying so hard, but
Yeah.
and just individualized medicine based on data, data-driven protocols for bio-individual treatments. I think that's really exciting.
Yeah.
But most importantly, I think a lot of people now are doing gut mapping and testing of stool as part of their optimization protocols. But I encourage everyone to look at their oral microbiome. And I will share a story. I have a close family member who's very healthy. She's in her 80s. She acts like she's in her 60s. Excellent oral checkups, goes every 6 months. And I thought, let me just test your oral microbiome. So I did. And she was through the roof with elevated F-nucleatum. Now, we would never have known this had we not tested. And F-nucleatum is linked to colon cancer. And she has a history of colon cancer in her family. So we cleaned her up. We put her on a protocol and reduced those numbers to get into healthy ranges. And I feel so much better about the next decade of her life and beyond, because this is something that it was a preventative approach. But had we not tested, there was no way you would have known until the signs and symptoms came, who knows how many years down the road. So there's a lot of information we can have. And certainly if we're working with couples trying to conceive, I wish every fertility clinic on the planet started talking about oral health and testing their couples' oral microbiomes, because we know a dysbiotic oral microbiome and patients with infection or periodontal disease in their mouth, it can take 2 to 3 more months to conceive. It can impact sperm mobility, sperm motility. And again, as I mentioned, pregnancy outcomes, low birth weight, early delivery, and then miscarriages too. So it's really important.
Yeah. Have you seen the data on, we could talk about this, like you're getting me started, we could talk about this particular topic for hours and hours because I've got a million questions and I'd love to pick your brain on. But have you seen like the information around, what's interesting to me is this is like a generational issue as well, because we used to think that in the womb, babies were sterile, or like the womb was a sterile environment. We know that's not true now. there's a microbiome in meconium, which is a baby's first bowel movement. So in order for that to happen, we know that they basically have a gut microbiome in utero. So it's not through birth that they start their microbiome seeding. That impacts it. But if we roll it back, there is an in utero gut microbiome in the baby. Now, when they look at that, it's connected to the placental microbiome. And when we look at placental microbiome, that is most connected to mom's oral microbiome.
That's right.
And that is so fascinating to me. And I think they also believe that that is related to the timing of birth, like you said, like preterm birth or late delivery. There's just so many connections there that I'm amazed we're not spending more time
I know.
figuring that out right
Because
now.
we know it's probably the answer to most everything, right? Or at
Oh,
least,
absolutely.
yeah.
Yeah, I'm obsessed with the reproductive microbiome. And I think we have like about 30% of infertility cases are unexplained. And I think as we get more into microbiome understanding and reproduction, I think a lot of those are going to fall into that category. I was talking with a clinician about a case yesterday of unexplained infertility. And it's like, the patient had painful intercourse and like a lot of other signs that there was like inflammation going on in her pelvis. And it's like, okay, well, let's take a microbiome approach. And I'll be curious to see how she lands with that patient
But
because
has anyone looked in her mouth?
I probably not. And I'll actually follow up with her now that we've had this conversation. And it's really interesting because I think if you're trying to conceive or you're pregnant right now, you might think, oh gosh, like I didn't go for those perio cleanings that were recommended. And there's a timing issue too, because you
Yes,
really have to treat it even
exactly.
before a preconception period. Can you talk a little bit about that and why?
Yeah, I mean, ideally, you want to clean up the system before we conceive, but not everyone has this luxury. But yes, if you have a failing root canal or infection in the mouth, gum inflammation, and this includes for the partner, moms get blamed for everything. The women get blamed for everything. It takes two to tango. Okay, we both need to have optimized microbiomes, but you want to clean up the system to ensure that, as to your point, inflammation is down, the system's optimized, that we're ready, that hormone pathways are optimized for conception, and then beyond that we are properly utilizing and growing our baby through nutrient absorption, so the gut is absorbing nutrients efficiently and making them bioavailable to really help source and grow that child. Because what we're seeing, this is a side note, there is an epidemic right now in hypoplastic enamel in children. That's undermineralized enamel of the teeth. This is starting in utero. So these are mineral and nutrient deficiencies or environmental exposures and toxins that a mother is exposed to. And I believe too, the oral microbiome, we're going to learn more, starts in utero as well. It's not just the gut. There is actually an oral microbiome starting as well. And so how are these all communicating to each other? And, and then we add medical interventions through modern birthing practices, which I'm not here to advocate or one way or the other, but, there's more intervention than there used to be. There's more medications, more antibiotics, more cesareans. And so how is that impacting the child also, especially in those first 1,000 days of life, which we know is so critical for microbiome development in a baby, and beyond. And so to your point, there's just why aren't we spending more time on this? Like, who can I talk to at the NIH? But I see a shift happening. I mean, just things like this. We're talking about it, and there's, quite frankly, a lot of money here in biotech to be had. But I'm starting to see this at conferences already, more tailored protocols. I just think we need more research too to back it up. But it's an exciting time for sure.
Definitely. Now, I want to come back to this kind of like specific clinical approach, but I think there's still some learning for our listeners around other impacts with oral health and oral microbiome. And of course, we're a hormone podcast, so I've got to start there.
Yeah.
We know that there's like major shifts in the microbiome throughout life and throughout hormonal periods of change, puberty, pregnancy, perimenopause, menopause. Are there similar shifts in the oral microbiome when it comes to these kind of hormonally charged times of life?
Oh, yes. Yeah. So I thank you for mentioning puberty too, because so many teenagers get blamed for poor oral hygiene, and it's actually hormones. We have estrogen receptors in our gum tissue So generally during surges or changes in hormones, we will have more gum inflammation and bleeding gums and things. And so this is preliminary. We definitely need more research around this, but how hormones influence the oral microbiome. It does tend to lead to a more dysbiotic environment. It can impact salivary flow. That can impact the oral microbiome. So there's pH alterations, and so we tend to have more pathogenic bacteria during that time, and less diversity as well. So this is where supporting a patient, oral hygiene, seeing the dentist regularly, diet, lifestyle, hydration all make a big difference. And certainly most women have experienced this too during pregnancy. And then part of my passion is also speaking about perimenopause and menopause, and how shifts in estrogen and progesterone are changing our oral health as well. This is when a lot of women might report temporomandibular joint issues, because we know progesterone impacts collagen synthesis. Teeth might feel like they're shifting. We have a periodontal ligament, which is made of fibers, collagen fibers, that can be impacted through hormonal changes. And this is partly why, too, I'm excited that we're talking more about hormone replacement therapy, staying ahead of this, because the long-term impacts can be significant once we go beyond the point of no return, if you will. And unfortunately, especially in pregnancy, we've made women afraid of going to the dentist during these times, for various reasons. And so I think we need to shift that, and within reason, within safety, to say we need to stay up on these things. And if there's infection in the mouth, we need to get rid of it. And this can include bad dentistry. Unfortunately, I think dentistry is to blame for a lot of these issues, and that can impact our hormones too. If you're having chronic inflammation, you're in pain, you're going to have elevated cortisol, and elevated cortisol impacts salivary health, and it decreases salivary flow. And if you don't have enough saliva, you have dry mouth, and dry mouth leads to cavities and gum disease. So there is definitely a trajectory here where it's important to discuss. And low testosterone in men, I mean, that impacts their oral health too. They tend to get more bone loss, fiber detachment, so more periodontal disease also. And so we're seeing a surge in that, right? Low T. So it's important to discuss.
It's really fascinating. It's like there's this kind of bidirectional impact where you have the oral microbiome that contributes to systemic problems and maybe hormone imbalance. And then additionally, the way that hormone changes impact the oral microbiome.
Yes, it's cyclical, absolutely. Especially for the poor pregnant mamas, I mean, up to 75% of women experience pregnancy gingivitis, and it's really hard, and they can have long-term impacts, losing bone around their teeth if someone isn't staying on top of it and educating them. And again, so many women are terrified to go to the dentist, but if they were just told, well, this is hormonal, this too will pass, but actually you need to be more on top of your oral hygiene more than ever right now. And how could we target and support your oral microbiome during this time?
Yeah. What would you say? Because I think that is a big fear for a lot of women, and a lot of pregnant women. And I know my dentist told me that like that increased sensitivity and even bleeding with flossing and things that maybe you never had can happen in pregnancy.
Yes.
I've had 4 pregnancies, experienced that with all of them, and it did pass. But what element of that is normal, and when should women know to like seek help because it's beyond normal?
Yeah, I would say it's always normal. Okay, I think it's because of surges in our hormones and shifts. And then as well, you'll notice toward the end of your pregnancy, women report their teeth shift sometimes also because relaxin has kicked in, and that changes the periodontal ligament around our teeth. But I think the biggest thing is it's not to say it's not normal. It's just to say, well, maybe we need different protocols to stay up on things, so that this doesn't turn into something that, instead of being fairly acute, turns into something more chronic. And I know so many women that just don't go to the dentist at all when they're pregnant because they're scared because of, I'd say, antiquated guidelines that made even dentists afraid of touching a pregnant woman. Just, you're good. I'll see you after the baby comes. So I like women to go in more frequently, just for cleanings maybe, or just really staying up on things from an oral hygiene perspective and nutritionally. And unfortunately, so many women have a hard time with certain foods and staying nutrient optimized. So making sure you're working with your provider about if you need supplementation, How can we ensure that you are getting all your essential nutrients and fat soluble vitamins and minerals that are all important for dental development of your child and
Mhm.
arguably their oral microbiome too.
That's a really great point. I know that when it comes to menopause, we talk about lower estrogen levels impacting bone health. But can you speak a little bit to the impact on the teeth? And I think people kind of think bone and teeth are the same, and they're not quite the same. So maybe you can start by sharing like what's similar, what's different between bone and teeth. And then is there an impact in menopause on like the actual makeup of the teeth, the mineralization of the teeth, or the health?
Yeah, it I wouldn't say as much with teeth directly, except it can impact your salivary health, and your
Okay.
saliva is what's exchanging minerals, calcium, and phosphorus ions with your teeth to keep them healthy, especially during acid attacks, which is essentially anytime we eat. Okay, so anytime we eat, part of the digestive process is to break our food down. So the pH of the mouth does lower. Our saliva comes in, it buffers, it neutralizes, it remineralizes, it pushes minerals back into the teeth. So if you have low salivary health, that's all going to be imbalanced. So that's how it could directly impact teeth, I would say. But mostly what we see is more the tissue. So the
Mm-hmm.
gum tissue and the attachments and the bone. And many women also will complain of burning mouth syndrome or metallic taste in their mouth too. And there's a phrase that we can actually see perimenopause and menopause in the mouth before maybe a woman even notices that she has it. And we can tell by the health of the tissues. It's kind of out of nowhere, nothing's changed, but all of a sudden we're seeing attachment loss. She's complaining now of burning mouth or weird sensations in the mouth. It's just uncomfortable. She feels dry a lot. The tissues feel dry. The teeth are shifting. We're starting to probe, when a dentist goes
All
three,
right.
four,
Oh,
we're
that is the worst. I'm
it is the
sorry,
worst.
dentist.
I
That
know.
is
I know.
like
I'm
honestly,
sorry.
I love going to the dentist, but when they say they're gonna do that, it's like nails on a chalkboard. I'm like,
I
oh,
know. This is where AI is going to help us, I think,
ah.
because there's ways to screen a bit better than that. It's pretty
Mhm.
barbaric and archaic. I completely agree with you. But and also, so we can have bad sleep during these phases, and that can impact our airway health. So inflammation in the body during some of these hormone cycles and changes, it can change the way the muscles there are myofunctional balances, and we can get more inflammation and redundant tissues, and we start becoming mouth breathers.
Mhm.
There's a big uptick in this in perimenopause and menopause in women, and it's very underdiagnosed. And this can impact the oral microbiome too. So if you mouth breathe, we dry out our tissues. We're losing the benefit of our saliva. Our saliva is incredibly important for our health, and also the pH drops. Not to mention, it impacts our hormones too, like cortisol shifts. And we're not getting into deep restorative sleep, and you'll just feel terrible if you're mouth breathing, snoring, and this is a continuum. And so sleep disordered breathing often can lead to sleep apnea as well. And we know that chronic mouth breathing can impact the oral microbiome and the gut microbiome too, for various different pathways. So
I had a
after.
personal experience with that with
Oh
my
yeah.
son because he always has had like allergies and congestion, and he would get cavities all the time even as a young child. And I'm a naturopathic doctor. We eat like salmon and
Hmm.
cucumbers and vegetables, like that literally pristine diet, like none of the, and I pay attention to what you put online, like no goldfish crackers and the
Yeah.
raisins and all these things that we know, and we can talk about that. I'm sure parents have that question, so we'll get into the kind of your tips around that. But really interestingly, that's really where I started to research the impact of mouth breathing, because I think that was his big driver for getting so many calories. And calories, cavities. And it was when we got his allergies kind of in better
Yeah.
check that his cavities stopped. Now he's 13 and he's really not experiencing any, which is great. Although he developed type 1 diabetes when he was 9. And I
Oh,
think about the role of that with like the oral microbiome in his gut and the impact on his immune system and just the complexity of these and the connections of these, and why this goes to show you why something that might seem so small can be
hmm.
so impactful, like the case you gave of your family member with like maybe you prevented a case of colon cancer. How amazing is that, just by restoring oral health, which relatively compared to chemotherapy, radiation, surgery, like wouldn't we rather spend our time and money there?
Absolutely. Well, I have so many comments on what you just said. So number one, I'm so happy you figured that out. Um, Let me speak about blood sugar real quick, and then we'll go back to airway. So, periodontitis and diabetes are bidirectional.
Mm.
I had a mom reach out to me on social media from Australia fairly recently, thanking me for a post I did that I honestly don't even remember doing, because her son was diagnosed with type 1 diabetes. They didn't know what was wrong with him, and his teeth were just crumbling. And it was because of blood sugar imbalances in his saliva, in his salivary
Wow.
health. So, again, you can't underestimate the power of saliva. But going back to airway, um, the first thing I think of, so I have a very specific patient population. I'm very fortunate. Everyone tends to be very motivated and on top of these things, as you are. And so many of them come in and their kids are eating salmon and they're eating cucumbers and they're eating this great diet, but they still have decay. And the first thing I think about is, are they breathing through their mouth?
Mm.
Um, Mouth breathing is one of the top reasons for decay. And it is, again, it's because of pH and microbial shifts that are happening through mouth breathing. Our saliva is lost. Dry mouth, xerostomia. We see this with cancer patients undergoing like radiation and chemotherapy protocols. So please don't ignore how your child or you are breathing. But then speaking of food, so ideally a whole food diet, of course, but I think what so many parents don't realize, and we're stuck in this busy modern society and we're on the go and we're doing the best we can, but these ultra processed foods, these hyper palatable foods, these packaged foods, they're very much impacting your oral microbiome. And so the way I teach my patients, my pediatric patients, I say we need to feed our good guys. We need to eat the rainbow. It's the prebiotic fibers, the polyphenols. That's what the good guys want to eat. And then the pathogens, they like fermentable carbohydrates. So those are the goldfish crackers, the chips, the pretzels, the granola bars, the fruit stacks, the fruit leathers, the dried fruit, the Go-Gurt. It's all those things that are marketed to be quick and easy and maybe relatively healthy, because we think, well, it's not a cookie, it's not a brownie, but they're sticky carbohydrates, and that's feeding pathogenic bacteria in the body, and you're going to get more of a pathogenic biofilm, and you're going to have more of a dysbiosis when you're eating foods like this. And you'll hear like the carnivore community, they'll say, oh, I don't even brush and floss my teeth, and I'm not advocating for this, but in a way, I don't totally disagree, because their biofilm is probably relatively light and healthy, to be honest, because they're not feeding the pathogenic bacteria. They're really feeding their commensals and their beneficial bacteria.
Yeah, I mean, it's interesting to me to think about like kind of the origin of this, and you might agree or disagree, but like the Weston Price Foundation, like Weston Price is a dentist, and he was looking at health factors and, not just of the mouth, but otherwise in the connection to whole foods, a whole foods diet or ancestral traditional diet. And his big connection initially was oral health.
Yeah.
Yeah.
Yeah. I love Weston Price. He's the father of functional dentistry. And he spoke not only of, yes, what nutrients are missing. Why are we having this surgence of dental disease, which we saw pick up from when we went from a hunter-gatherer society to an agrarian society to the Industrial Revolution. What happened during this time? Our food shifted so much. And we now are nutrient deficient. So we're mineral deficient. Specifically, magnesium is really important. And then fat-soluble vitamins, vitamin D, vitamin K, A, specifically really help oral health as well. He also spoke about how the human skull is shrinking. So ancestrally, we used to have big, wide jaws, nice, wide teeth. We were obligate nasal breathers as humans, and now everybody mouth breathes. Go to any airport and just watch people. How are they walking? Forward head posture, open mouth, low tongue, like Napoleon Dynamite. But if you look at skulls, they're getting narrow. They're almost just, smushed. And with that, we're getting high, narrow palates, deviated septums. Our sinuses are shrinking. Our tongue doesn't have space to fit in our jaws anymore, so it gets pushed forward or it falls back, which leads to mouth breathing, which leads to snoring. And Weston Price spoke about this is due to how we're not chewing as much as we used to. We used to chew for multiple hours a day, foraging, and now we chew for just minutes a day. Everything's mash, mash, swallow. And it's those outward forces, form follows function. It's those outward forces from mastication, starting with breastfeeding, that grows the face, that spreads the palate, and really creates the airway. And there's a book, Breath by James Nestor. If people are interested in this, I highly recommend it because airway is a huge component of your patient's health too. So it's not just their gum health and their dental health and do they have a failing root canal? How are they breathing? And what is their skull shape and their jaw shape like? It's very important. This gets overwhelming, but it's a big piece that's missing because if a patient's not breathing optimally, that will impact every system in the body, including the oral and gut microbiome.
That's awesome. We'll make sure we put that link to the book in the show notes so we can check it out. I'm interested in checking that out for sure.
We'll be right back. Here at Precision Analytical, we've launched the biggest update to our report since 2013. The new and enhanced Dutch report puts the most actionable hormone insights right on page 1, making it faster and easier to interpret. You'll see a reimagined summary page, upgraded visuals for estrogen and cortisol metabolism, and an all-new About Your Results section, what we call the Dutch Dozen, a 12-point framework that helps you understand your patient's hormone story in minutes. It's a smarter, simpler, and more insightful Dutch experience. From now through December 19, 2025, all registered Dutch providers can order 5 Dutch Complete or Dutch Plus kits for 50% off. Give us a call or visit DutchTest.com/order now. Must be a registered Dutch provider. Promotion not available through distributors. Can mix and match Dutch Complete and Dutch Plus kits. Prepaid only, no drop ships. Cannot be combined with any other offer. Kits must be purchased by December 19, 2025. Welcome back to the Dutch Podcast.
Just as a side note, if you're ever in Boston, there's a great museum. Like Harvard University has this great system of museums and they're so cheap to get into, but they actually have a natural history museum and it's small, but it's really rich. And they have really cool skeletal exhibits, including human skeletons, which I think probably you need special permission to do now, but these are like from the 1950s.
Yeah, I really like looking at ancestral skulls. And I encourage everyone, if you go to the Natural History Museum, look at what our skulls used to look like. They were huge and broad and wide and straight teeth, no orthodontist, no dentist. Why is that? And no cavities. Humans didn't get cavities. We're one of the only species that gets dental decay besides our domesticated pets. Maybe certain tribes where there was high fruit or honey content, but why is that? Why has there been such a surge of dental disease? It was the Industrial Revolution, the Agricultural Revolution, the Industrial Revolution. It's once we started packaging and milling and processing food. That's when we saw a surge in dental disease. And how do we want to correct that? We correct it with products and ingredients and fluoride. And, it's a Band-Aid. We need to address the elephant in the room.
Yeah, I want to talk a little bit about what we can do, like what we should be doing proactively. But I think the last piece, because we are the Dutch podcast, is like when we're understanding the connection between hormones and oral health. Is that something that you think testing is important for? Or, is it that oral health informs why you really should have your hormones checked, or that hormonal testing, whether it's cortisol, estrogen, progesterone, testosterone, should influence kind of the way we care for our oral microbiome and oral health?
I mean, it's bidirectional again. Wouldn't it be nice if we just routinely tested patients for both? So I certainly think if you are seeing a patient in your chair, let me say I'm speaking to dentists, and you're suspecting maybe there's hormonal imbalances, particularly in a perimenopausal or menopausal woman. Okay, well, let's not get to menopause. Let's say we want to be upstream, right? So I would encourage, of course, them to hormone test so that we can stay ahead of it. But with oral microbiome testing, I think everyone should be oral microbiome testing.
Is there a company that you recommend that's like commercially available to consumers, or one that docs should look at too?
Yeah, there's a couple. I really like Bristle, like a toothbrush Bristle. It's direct to consumer. It's a great interface. They give protocols. It uses shotgun metagenomics, which is my preference. But Viome with a V, I'm seeing them more at functional medicine conferences, and they're doing very cool stuff with bio-individualized treatment planning too. So those are a couple of my favorites, but there's so many popping up now. I mean, it really is exploding.
Great. So let's talk a little bit about like a kind of a typical case. If a new patient came in to see you, I know you do pediatrics, so your population's a bit different. What is like the typical situation for like the average American that you see on a day-to-day basis, or that functional dentists are seeing?
Yeah, I see pediatrics, but I consult on adults too, and I'm looking to open a female clinic, a women's
Amazing.
clinic as well, to work more directly with fertility doctors and hormones and things as well. So stay tuned. The typical thing I see, gum disease. I mean, gum disease is very rampant. I think people aren't flossing and they're snacking and sipping much more than they realize. So just like we should eat on a schedule, ideally for the migrating motor complex and to preserve our gut health, we shouldn't be snacking and sipping all day. That is influencing the microbiome. It leaves our mouth in a constant state of acidity. So people think they're doing a great job, and mostly everyone is, but there's just small tweaks that can be made that could really help optimize people better. I see a lot of dehydration. People are so dehydrated. And then stress. Don't underestimate the impact of cortisol on your oral health. And it's not only your gum health, but also your clenching and grinding. Like, so many people are wearing their teeth and getting microfractures and fractures and breaking fillings and cracking crowns. And stress management should be part of dental management as far as I'm concerned. So those are some of the big ones. But I think don't ignore your gums. If you have inflamed gums, if your patients report they never floss, if they do and their gums bleed, or we call it pink in the sink. When you spit after you floss and brush into the sink, is there pink? That's a sign of inflammation, period. Okay, and it's systemic. That's not just staying in the mouth. So we need to get that under control. Just as you would any other inflammation that you saw in your patient in their body. So really look toward their gum health too. It's important.
The flossing piece is such a hard piece for people to get in. And personally, like, I've had it as my New Year's resolution. I'm like obviously the most boring person on the planet because my New Year's resolution was I want to floss
That's
my teeth
great.
regularly. And this year I'm finally into it because I bought the Slate flosser, which is this like vibrating
So,
flosser.
oh, I know Slate well. They're amazing.
Yeah, they're amazing. And actually, I got it for myself and my husband for Christmas, and he told me it was the worst Christmas gift he'd ever received,
Oh
and
no.
that I might as well return his. And now he sees me using mine, and you can change the heads, and he's tried it, and he's like, "Can you actually buy me one of those because they're
Oh
amazing?"
yeah. You're
But
like, I'm preventing you getting colon cancer. That's the best gift I could give you. Thank
I'll
you.
make sure that I tell him that and have
Yeah.
him listen.
Or
But what I love
Alzheimer's.
about it is that it has these like massagers in the front and
Mhm.
back that I feel like really have changed my gum health
Yeah.
personally. And I read a statistic recently that if you don't floss, you're missing about 40% of your
Yeah.
surfaces of your teeth, which,
It's
like, holy
true.
cow, it's
Yeah,
so
because
helpful.
your tooth, this is, yes, your tooth has 5 surfaces. Okay. If you're brushing, you're only cleaning 3 of the 5. So 3/5. So you have to be flossing, but also think of it this way. If anyone's played guitar, when you first pick up a guitar, your fingers are raw.
Hmm.
You have to be practicing daily to develop those calluses. It's the same with your gums. We want very resilient, healthy gums. It's a barrier from the outside world to the inside world. We don't want to create a way for bacteria, viruses, parasites, all these things to get into the system. So we need a very healthy mucosa and gingival tissue. So don't take it for granted. But flossing is hard. I mean, do what works for you. Here are some tips. Get a suction cup mirror and do it in the shower. Okay.
Oh, good idea.
Get a cordless water pick and do it in the shower or the bathtub if you have kids. Floss picks, they're fine. Leave them in your car. Leave a bowl by your nightstand. Leave some where you watch TV or read your book at night. We need a habit stack too, like we know this. Like, you're not just going to start doing something after 4 decades of never doing it. You have to find ways to trick yourself into it. Leave little sticky notes. Use a tool that you think's fun, like the Slate flosser. So you have to play around with it, but I just mostly want people to really prioritize it. I think it's more important than brushing.
I was going to ask you that.
I will be on my deathbed yelling that. If I was at a desert island, you're like, you can bring a toothbrush or floss. I would always say floss. Always, always, always would I say floss. So, yeah.
That's awesome. Now, if you could wave a magic wand and get the average American or our average listener here to change like 5 practices. So flossing regularly is number
Yes.
1. What else would hit the list for you?
Stop snacking. I just think we eat too much. And I want people to be focusing on protein-rich foods, starting that early in the day, eating on a schedule, ideally every 2 hours. That's going to help hormone balancing too. We know this. So we just snack and sip too much. And this includes your drinks. Like people think, well, it's just my coffee. It's just a little bit of sugar in my coffee. Well, that will influence your microbiome, certainly. And the acidity as well. Sparkling water. People are like, well, it's fine. And I'm not saying don't drink these things. I drink so much. Don't get me wrong.
I know. I was going to ask you, if you guys are just listening, my face like, because I heard this online and I'm like, oh God, even soda water. We can't even do soda water.
Because it's acidic. So
exactly. I understand.
Here's the thing. You might be a human, if you go in and you have no issues and you have no sensitivity and your hygienist or dentist isn't saying you have enamel wear, don't worry so much about it. But if you go in all the time and you keep getting cavities and you keep having issues and your fillings keep failing and you have all this sensitivity and recession, I mean, you should look toward the acidity of what you're drinking. But the biggest thing is, even if you're drinking mineral or soda water, don't sip it all day. You want to sit down, consume it in a fairly short amount of time. That's the biggest thing. We need to give our mouths and our guts a break. Okay, so don't stress out too much about that. But don't forget your drinks, the frappuccinos and the kombucha and all of these things, it adds up. So that we spoke about airway and snacking and flossing, and nutritionally optimized. We have to make sure we're getting all of our minerals and our fat soluble vitamins. What you put on your fork every day influences, it's information that you're giving to your cells and to your mitochondria and to your microbes, okay? So we want to try to make sure we're getting a wide range of colorful foods every day and fermented foods. A spoonful of fermented foods every day can go such a long way, including supporting the oral microbiome. So the sauerkraut, the kimchi, those homemade naturally fermented pickles, the kefir, please don't ignore that. It's something I prioritize. Even at the end of the night, I'll say, oh my gosh, I didn't have anything. I'll take a spoonful of sauerkraut, which I know some people may not find to be super appealing, but it's a mindset shift, right? I'm trying to feed the good guys.
One trick I have with that is I use a small amount of kefir to take my supplements, and I have trouble swallowing pills, and like the thicker liquid makes it so much easier to go down. So that's the way I sneak it into my like habit stacking, as I always take that with like a little bit of drinkable kefir.
I love that. And then I guess I'd say hydration is so important too. I think some of us are over obsessed on consuming water, but the problem is our water is devoid of minerals and salt, and so we can drink a lot of it, but we may not be utilizing and absorbing it appropriately. So please don't forget to hydrate, but also adding minerals and salt into your water, because that's going to help your spit, your salivary health. Your saliva is this golden elixir in our bodies, and if it is suboptimal, you're going to have a slew of health issues. So please don't ignore your saliva.
Fabulous. Those are great recommendations. I want to ask about a couple things that I know come up often in my patient conversations regarding oral health. Impact of alcohol-based mouthwashes.
So the data on this is pretty clear at this point. So alcohol and astringents are carpet bombing the mouth. It's just like we're over disinfecting, right? We don't need to kill 99.9% of bacteria as much as the marketing tells us so, because these things aren't selective. So they're disrupting the pathogenic bacteria, but they can be damaging the commensal bacteria as well and the beneficial bacteria. So less is more. Patients always will say, when I say skip the conventional mouthwash, they'll say, well, what do I do instead? I just like water and baking soda, maybe with a sprinkle of high quality salt, because that's going to buffer and neutralize and make the mouth potentially more alkaline where pathogenic bacteria can't thrive. But also, if you're suffering from chronic halitosis, really bad breath, and you feel like you constantly need gum and mints and mouth rinse, that really strong burning mouth rinse, you have dysbiosis. You have something going on. You have an infection. You have periodontal disease. You have a failing filling or crown. There is something not normal in this situation. So please work with your dentist to discover what that is. It can be coming from the gut. It can be coming from the sinuses also, and back in the throat also, like tonsil stones, etc. So, but the studies show, so what happens with these alcoholic based mouthwashes, they can wipe out the bacteria that like to hang out in the dorsum of the tongue, and these are nitrate reducing bacteria, and it can impact nitric oxide production. And so the studies are showing that patients who chronically use these mouth rinses can have higher blood pressure, high blood pressure. It can impact sexual health, so erectile dysfunction, just basically vasodilation, so cardiovascular health in general. So there's some links to oral cancer as well with really chronic use. I think obviously we need more research in that, but it makes sense to me, something that burning, I mean, we shouldn't be putting these emulsifiers and surfactants and these foaming agents and these things that are very essentially caustic in the mouth. Like, what is that doing to the microbes, but also the mucosa?
That kind of brings me to the next one, which is toothpaste, which is, I know there's a lot of like, kind of like the nanohydroxyapatite type toothpaste available now compared to like a conventional one with foaming agents. Can you talk a little bit about what people should look for in a toothpaste?
Yeah, so nanohydroxyapatite would be the active ingredient, the remineralizing ingredient, if you will. So that's going to be a personal choice. Do you want to use fluoride? Do you want to use microhydroxyapatite, nanohydroxyapatite? Theobromine has really great research behind it now too for remineralizing. But you want to
the
look at
same one? Isn't the bromine in chocolate?
it is. Yeah.
Oh, wow. That's
Yeah.
another plus on the
I
chocolates.
know,
Okay.
totally. And it impacts remineralization. And some studies, depending on the formulation, show it can work as well as fluoride too. I love nanohydroxyapatite. I actually really love theobromine too. Regardless, so that's your active ingredient, but you do want to look at all the other ingredients. So just like we're now cleaning up our cosmetics, and I think we've learned too, we don't need to wash our hair as often. We don't need all that foaming in our shampoo, and we've maybe switched to different aluminum-free deodorants, and there was a transition period potentially we experienced as our skin microbiome shifted. It's the same with toothpaste. So I want people to try to get rid of the sodium lauryl sulfate or its derivatives, I would say, and those can be coconut based, but some people are really sensitive to them. You can get oral ulcerations. It's irritating the mucosa. It will dry out the mucosa, but that can shift the microbiome too. So your toothpaste really shouldn't burn or foam. Essential oils, be careful. I know they sound amazing on paper and it gives us that fresh breath feeling, but they can be antimicrobial and they're not selective. So just be cautious with some of these things. Triclosan, and there's just a lot of ingredients. Luckily, we're moving away from that. So like, what do you use? Use what you will use, first of all, is my first recommendation. But I do, if you're suffering from dental issues, I would look to a hydroxyapatite based toothpaste. There's a lot of literature and data behind that. It's been approved for consumer safety in the EU, and the health ministries in Japan and South Korea are using it almost exclusively now in oral healthcare products. So I think there'll be a big shift in oral healthcare products, certainly, but I like a less is more approach, and I want people looking at their toothpaste, reading the ingredients like they read their food ingredients.
I love that. The next one is I really see this like massive trend towards whitening right now, and I wonder about the impact of a lot of those products on our oral microbiome, but also the health of our teeth. Do you have any thoughts on that?
Absolutely. Yeah. Yes, we're an aesthetically driven society, which, I'm all for. I want people feeling good about themselves. Mental health is very important, but I do also worry about overusing bleaching products. I have seen on TikTok the hydrogen peroxide trend, and these teeth are just glowing white. But what they don't understand is the biology behind this. So it's stripping their enamel of minerals and the protective layer that's necessary. A lot of these kids, they're kids to me, are going to end up with chronic sensitivity, if not pulpal nerve damage and needing root canals and all of these things too. So we just want to be very cautious. I don't love charcoal toothpaste. It's far too abrasive, so it can really damage your enamel. But I also understand, and these bleaching agents too, all of these things are impacting the microbiome in a negative way, okay? But I don't like to say never do it. So we need to set up realistic expectations. We are so over inundated with filtered images and photoshopped images and veneers. And I'm not here to judge veneers, and I want everyone to do what they want to do. But anything you put in the mouth is shifting your microbiome, whether it's a filling, a veneer, a crown, a grill, whatever you're doing. Think about the long-term impacts of that, because it's never going to be as good as your natural tooth structure. I personally would rather patients spent the time and went through like Invisalign or just something. I know it seems not a quick fix as veneers, but straighten your teeth a little bit, maybe whiten them a little bit, and then try to just keep your natural teeth as much as you can would be my advice. But because nothing in dentistry lasts forever. And for all of us that are saying, I want to live into my hundreds, 120, all of these longevity ideals, your teeth need to last that long too, right? So at least for now, we don't have the technology yet to regrow teeth. So just think of that when you make these decisions. But, baking soda and a little bit of hydrogen peroxide occasionally, I think is great. If you want to whiten, your dentist can do whitening procedures for you. I would just say don't overdo it. Look, bright white teeth is not a natural tooth shade.
Yeah.
And everyone knows it's not real. It's just too much. So I hope we transition back to what is more of a universal shade and what's natural. And then there's certain foods like strawberries have gentle acids in them that can brighten and whiten a little bit, but in avoiding like wine and coffee and tea and going in more for cleanings. There's Crest white strips, of course. There's Luminu has white strips made with more botanicals and herbs that it works pretty well. So there's different things out there, but just my biggest thing is don't overdo it.
Take it easy. Yeah, it's funny when they look at in the dentist office, when you ask about whitening, they'll show you kind of that scale. And a lot of people, they're already at the whiter end, before they even start. It just doesn't seem that way because it's not that bright white filtered image, like you said, you see online. The last thing I want to talk about is sweeteners. So I know that we're talking about staying away from things that are ultra processed, but I think a lot of people are concerned about the impact on microbiome, and oral would be a piece of this too, of all these artificial sweeteners. And I want to talk about xylitol and just share a little bit about that as well, if you can, as far as like what should people be using, what should they not be using?
Yeah, I know. So xylitol, when ingested in higher quantities, like with baking, let's say, or in drinks, can be very disruptive to the gut microbiome. But the amounts that it's used, the data shows that it has a beneficial impact in the mouth because it acts as a prebiotic. And it actually prevents bacterial adhesion and can help create better balance of diversity in the mouth too. So dentistry loves xylitol in dental products. I don't think we should be cooking with it and eating it and ingesting it. But again, I've seen some concerns with sorbitol and other sweeteners that other brands are using. I haven't seen any significantly impressive data to show that I'm concerned with this from the oral microbiome standpoint. But I think, again, if you're ingesting it, I think it's David Perlmutter speaks of concerns with some of these things, and lactic acid buildup, I believe is what he speaks of, uric acid buildup. So, but again, this is in very large amounts. So most toothpaste, it doesn't have a lot in it. Plus you're spitting it out.
You're not swallowing. Yeah.
You're not swallowing it. I love xylitol in nasal sprays.
Oh, that's the best.
It's so good because it alters the pH and it will alter the microbiome of the sinus too. So I think we're too quick to villainize things. Dose does matter, of course, and exposure and the means of exposure matters so much. But
and context, what's good for one person may not be or tolerable or great for another. So
That's
I appreciate you taking my hot seat questions because I understand it's not always black and white, the answers. Yeah.
Such
great.
A,
well,
be a human.
It's been so awesome to have you on today. I'm really happy to get the chance to finally meet you, and really just thankful for all the insights that you shared. I think this is a piece, I imagine, because we've got a lot of listeners, this might be the first time they've heard this kind of information, and hopefully it transforms the way they think about health and longevity and really gets them thinking about another aspect of their health that generally is easier to control than many because it's topical, right?
Yeah.
To really be able to make a big impact. So I appreciate the work you're doing, and I appreciate you being here.
Thank you. I appreciate the opportunity. Remember, to everyone, appreciate your saliva.
Love your saliva.
Love your spit. That's my take home.
And lastly, if people want to learn more about the work that you do, about your practice, what's the best way for them to connect with you?
Yes, thank you so much. Well, I have a website, drstaci.com, and I do a weekly newsletter where I unpack these concepts in more detail, because I know this was such a whirlwind and we could probably speak for hours and hours about some of these things. So check that out. I do see patients still in person in Portland, Oregon, at Bloom Kids Dentistry. It's pediatric focus, but stay tuned for potential new business endeavors where I'll see the adult population again, like I once did. And then I'm on Dr. Staci platform on Instagram, Dr._Staci. So I'm on Instagram, TikTok, all the things with that same handle. And then I am co-founding the Institute for Functional Dentistry too. And so I would love everyone to help spread this message. If you are a physician out there and you have a great dentist in your neighborhood that you work with or your community, but you just wish they knew more about functional medicine so you can work more cohesively, please share this with them. And I'd love for them to go through our curriculum, because again, I can speak to all of this on all these podcasts, but then at the end of the day, where do you send your patients to? Mm-hmm. Where do you go? And so we have to create a training institution that is accredited, where there's certification, that's evidence-based. And so this is what we're creating. It launches in January.
Wonderful. Well, thank you so much. And everyone listening, thank you for joining us this week. We'll see you next Tuesday.
Thank you.
Thanks for joining us on the Dutch Podcast. Join us every Tuesday for new conversations with leading functional health experts. If you like what you've heard, be sure to like, follow, and subscribe wherever you get your podcasts.